Hello everybody, my name's Charles Linden, I'm Director of Linden Tree Education. I've been asked to do this video because I'm having increasing pressure from people asking me to explain the true nature of anxiety and what it means to people who suffer, but also to make it understandable to people who look at anxiety from the outside and feel that people look frail or vulnerable, or that they're just overthinkers or over-worriers, because this is really a message not just for anxiety sufferers and people that want to understand anxiety, but it's also a message for those people in power, those people who have put us in a situation over the last 12 months which they felt was unavoidable, but which has activated a huge amount of anxiety in people that didn't suffer previously, and has exacerbated anxiety suffering in those who do suffer. It's absolutely vital that people start to understand what anxiety actually is, because it is so easy from the outside to assume that people are vulnerable, are in some way weak or shy, and that anxiety is the same as fear. Let me explain this in full. Anxiety is not the same as fear. People with anxiety conditions, and by those conditions I mean generalized anxiety disorder, panic disorder, agoraphobia, monophobia, school phobia, health anxiety, eating disorders, emetophobia, those who suffer from, excuse me, depersonalisation, derealization, that self-harm, those people with low mood who suffer from generalised anxiety. It is not the same as fear. Fear is a natural human emotion that developed in all of us through evolution to keep us safe. It's an alarm system that uses the senses to identify real threat. People who have anxiety don't just have too much fear. This isn't something they can discuss with people, that they can have counselling for. This isn't something that is going to be reduced by sharing their burdens, by sharing and for other people to understand their fears. Because this isn't about fear. It's very easy when you're talking to somebody with anxiety and you ask them certain questions to identify that they're worried about A or they're worried about B. They're worried about their exams. They're worried about being bullied. They're worried about dying. They're worried about getting ill. They're worried about fainting. It's not about worry. It's about anxiety. Anxiety is a condition. It is a disorder of the emotion of fear. And it is as physical and real as diabetes. It's as real and physical as being unfit. It is a disordered response. It isn't because these people are shy or frail or vulnerable or they overthink. It isn't because there's something wrong with them. People with anxiety conditions are in fear disorder. Now, what does that actually mean? It means that they can't help responding the way that they respond to incoming emotional signals through their senses. Their perceptions are different to people that don't have an anxiety condition. They don't mean to be this way. They don't try to be this way. It's not that they can pull their socks up or suddenly find confidence from somewhere, any more than somebody with diabetes could suddenly find insulin from somewhere. The suggestion that they can think their way out of it, talk their way out of it, share their burdens, share their fears, and it is in some way going to get rid of a deep disordered response within the system, within their mind and body that controls fear, is ludicrous, which is why these things fail. You can't medicate anxiety conditions out of people. There's also a school of thought that believes that things like obsessive-compulsive disorders, HOCD, POCD, ROCD, and I hate these acronyms because they don't actually mean anything, but it's how a lot of people identify themselves, that they're not related to anxiety. OCD, obsessive-compulsive disordered response, is an anxiety response. It's all tied up within the same group of issues. Now, when this happened to us in March 2020, we suddenly became very aware that people were saying that there was this pandemic, this thing that was going to kill a lot of people. Not only did it cause an activation of a higher level of anxiety in those that were already suffering from anxiety, so their anxiety increased, not their fear, their anxiety increased, because anxiety is disordered fear. But there were tens of millions of people, probably in Britain alone, but certainly across Europe and the world, hundreds of millions probably around the world, who are waiting in the wings to have their fear disorders. And I call them fear disorders for a reason, because they're not anxiety disorders. Anxiety is a disorder. This is a fear disorder. They were waiting in the wings, regardless of their age, to have their disorder activated. Now, that could have happened tomorrow, next week, next year, in 10 years' time, in 20 years' time, when they got to retirement age. It wouldn't have mattered when. But the point is, they were all activated pretty much at the same time in March 2020. So suddenly, instead of having a body of people that already suffered from these conditions, and then a few more people suffering because of activation over time, there was a sudden and catastrophic activation of disorder in millions of people. Again, it's very easy to assume that when the fear catalyst, namely COVID or lockdown or whatever it is people are responding to now, has gone away, and as people start to return to normal, there'll be an expectation that these anxiety conditions will go away, that anxiety will lower and people will just go back to their lives. What people don't understand is that isn't what's going to happen. That isn't what can happen, because these people are disordered. They have reset their normal emotional responses, and now they're calibrated to perceive threat differently. So when they try to go back to school, go back to university and return to normal life, they will feel incapable of doing so without intense feelings of fear, anxiety. Just taking away a threat to somebody who's been thrust into disordered emotional responses isn't enough to alleviate the condition. Once activated, they're going to have to go through a specific process to get rid of that anxiety condition. And that isn't readily available. But it isn't just a few million people now, as it was in, prior to March 2020. In the UK alone, there were millions of people already suffering. We're talking at 6, 8, 10 times that quantity now, a tsunami of mental health suffering. I refer to it as mental health suffering to make it easy for those people listening. But this isn't about mental health suffering. This is about a change in systemic response. It's about disorder. It's about the systems of the body changing the way that they interact because of fear. Now, we all know that what the knock-on effects of that can be. Anybody with anxiety will sit and tell you how it feels. Not only do they feel fearful when they shouldn't, but they often experience dizziness, nausea, indigestion, acid reflux, diarrhea, constipation, IBS, tingling limbs, dizziness, dry eyes, tinnitus, a lump in their throat, difficulty breathing, difficulty swallowing, smothering sensations. I'm not reading these from a list. These are things that I suffered from when I suffered from anxiety between 1972 and 1996. I could keep going. Anybody suffering with anxiety will sit there and tell any psychologist, any psychiatrist, any doctor how they feel. But unravelling that is difficult for most branches of medicine and psychology because they don't understand the psychophysiology of the condition. I understand it inside out because I suffered it for 22 years. And in 96, I then found a way out of that. And since 96, I've been helping literally tens of millions of people to understand their anxiety. And for people who don't suffer from anxiety, the loved ones, the carers, and for anybody that will listen, and a lot of people won't listen, by the way, because they have their own thoughts about this. But I try to tell everybody what it feels like to be an anxiety sufferer, to have a constant sense of doom, to wake up in the morning and immediately catastrophize about the day. In the case of health anxiety, to focus on dying, on fainting, on every lump and bump they can find in their body, to be on Google looking up every symptom. In the case of OCD and HOCD and ROCD and POCD, having these intrusive thoughts that are with you 24/7, even in your dreams. Anxiety wakes you up in the night with night frights, having panic attacks, your heart racing, sweating, not knowing where you are, not understanding why you're feeling this way. Self-harming speaks for itself. We see what happens with self-harming, but again, it's moved out of anxiety conditions, often into depressive disorders, because people don't understand it. Eating disorders, they belong within anxiety. They're not separate disorders. It's not about food. It's not about body image. It's about core fear. all of these conditions can be activated by a sudden catalyst of high fear. That can be anything. The dog getting run over, a friend getting hurt, a relative dying, divorce, money worries, stress at work. Those predisposed to suffering from these conditions can be activated at any time. And in March 2020, due to the doom-mongering, the scaremongering that we all witnessed across social media and the media, all of these people were activated at once. And once that box has been open and the jack in the box has been ejected from it, it is so difficult to get it back in again unless you truly understand the science of anxiety. And most people don't. Most people working in practice wouldn't be able to tell an anxiety sufferer what the lump in their throat is actually due to, how it developed, where it developed, what its evolutionary past is. Most of them wouldn't be able to tell you what a panic attack actually is. And it is something. It isn't just extreme fear and feeling like you're dying. Most people wouldn't be able to explain to you where an eating disorder comes from and what the focus is and why people develop them and why other people don't. What is derealization and depersonalization? To understand all of these things, you have to understand the psychophysiology of the condition itself. You have to understand why it forms, how it's formed, and what to do about it. Without that knowledge, you will never put that jack in the box back in the box. So anybody listening to this that works closely to the government, anybody that can get this, to the Prime Minister, to the people that work in health, that want to understand the true nature of this, because I genuinely believe that most people think that anxiety sufferers will just be fine when it's all over, that anxiety sufferers just need to pull their socks up, that they can do something about it. They've just got to rationalise it and understand it. That is absolutely not true. That's trying to say, it's like going to a personal trainer and saying to them, I recognise that I'm overweight. I recognise that I want to become more cardiovascularly fit. And the trainer says, okay, well, I can give you some tablets. And if you take those, it'll help you to forget how overweight and unfit you are. Or alternatively, I can give you some counselling and that can help you to come to terms with how overweight and unfit you are. Or alternatively, I can give you some exercise and a diet. And in 3 months' time, you're going to feel better and be thinner and fitter. Which one would you take? Not the first two. It doesn't make sense, does it? But this is exactly the kind of huge misunderstanding that perpetuates suffering. And now that we have such massively increased suffering, somebody needs to start to listen to what anxiety really is. Because it's not about frailty. It's not about weakness. And it certainly isn't something where you can just pull your socks up. I'm a relatively well-educated, degree-educated 53-year-old. Okay? I'm no shrinking violet. At school, I did karate. I played rugby at a high level, inside and outside school. I rode competitively. I didn't shy away from a fight. But all of it was through gritted teeth. All of it was through anxiety, obsession, compulsion, panic disorder, health anxiety, eating disorders eventually, derealization, depersonalization, OCD. It was horrendous. So take it from a guy that isn't a shrinking violet, that this isn't about vulnerability. It's about deep disorder. And if you don't understand that, you don't understand the true nature of these conditions, and there is nothing you can do to help anybody. We need to address this. There are tens of thousands, hundreds of thousands of children who now don't want to go back to school. Not because they're scared, because they're anxious. And if it isn't addressed correctly, this will never be rectified. And believe me, from a biological perspective, this isn't about just overcoming the current crisis of anxiety, suffering and mental health. Once this box has been opened and you've modified these people to respond differently, you've changed, you've diverted the course of human evolution. I won't go into that too deeply now, but you really need to understand this isn't something that's going to be easily cured. You need to start to understand anxiety sufferers, and you need to understand how horrific it is to wake every day and have nobody tell you how to stop the constant sense that you're under threat. because it genuinely is horrific. Horrific. Thank you for listening to me, folks. Take care.